Hi guys, I know it's been a while. I'm Aaron for whoever's seeing me for the first time. And let's get into what the video is about. Ocrevus. So basically, side effects. I haven't received any side effects from the medication. None that I can pinpoint and just tell you, hey, look out for this. One of the things I know that I was terrified of is that the medication I was on before, Tysabri, um, there's history of a patient switching, and when they took an MRI, they saw white matter, which is basically dealing with like brain disease, and so that's what I was terrified of. Only when I researched that a little bit more, I found out that on MRI, it was missed. The white matter was actually missed before that particular person switched. I don't know if it was a he or she. Before that particular person switched, they had white matter there, and but I guess they had to put it in the books that was something that happened. So once I switched, I got to be honest with you, on my first dosage, it's been about, I want to say this is my third year on it. Um, so the first time I took it, I felt wonderful. They gave it to me in two dosages. They gave me something toward the very end of January, and then they gave me the second dosage on the front end of February. And so they did it that way to make sure my body can handle it. They don't want to give you the full dosage, and when they do give it to you for the first time, they're going to do a slow drip. So that's what. Oh, sorry, somebody's talking out here, but that's basically what happened. After that, I felt wonderful. Now, 3 years later, it's sort of wearing off. And on top of this, as you get closer to the time that you're about to take it again, what ends up happening is you start to feel horrible. Now, I say you, but I really mean I felt horrible, and the doctor let me know that's something that was common among the MS patients that took Ocrevus. You start to feel like all of the horrible things, not that the things that you go through from day to day don't happen, the pains, the issues and all that, they still happen. It's just that it seems like they come full force as you get closer to the date that you need to take it again. So my doctor, she found an sort of a workaround, if you will, on that for this last infusion, because she noticed that I was feeling horrible. She moved up the date. So instead of every 6 months, she moved it to every 5 months, close to the end of that particular month, to see if she can head that horrible feeling off, at the past, to keep that from actually happening. So I don't know if it's going to work. Hopefully it does. I'm not having such a good day today. I'm internally, I'm feeling right now. I'm feeling horrible. I feel real horrible. The thing I get from family members all the time is, and friends, well, you seem fine. You look fine. It's like, well, when you deal with something every single day, it doesn't affect you as much as it would affect the next person that doesn't have to deal with that. So basically, dealing with pain every day, I can still smile, you know. So yeah, there's a whole host of things, but the Ocrevus is, I put it like this: everything's fine so far. So I'm in my third year. Everything's fine. I haven't had a issue yet, except the ones that I actually mentioned. I don't know of honestly, any side effects dealing with this. So I listened to this. I want to say Aaron Boster or Aaron. He has the same name as me. I listen to his vlog all the time, and it's wonderful. It's so informational and informative. I didn't mean to say information. It's informative. So informative, and it allows me to maybe sometimes ask my doctor about certain things. instead of my doctor brings things to me, and to see what they think, because they're the ones, with their eyes on your information, knowing what to say or do for you specifically. So that's one thing that I enjoy. And back to what I was saying, listening to Aaron Butler, he told me this was he not told me he said that the Ogrevis is like Ferrari and Lamborghini and all those great sports cars, and the Copaxone that I was taking was like a Focus or something, like a Ford Focus or Dot or something. Yeah. So it wasn't. It can work for some people, but for mine, I had already had a relapse, and so and I was consistently having relapse while I was on it. So you just have to know your body. Let your doctor know what's going on with you. Everybody, y'all keep doing that. Let your doctor know exactly everything you're going through, and you never know it. With all of us combined, saying that this is an issue, the doctor can look down and say, okay, this is something that has been happening a lot anyway. So everybody, tell them everything. Right now, I will tell you that my chronic fatigue is beating me up. I take modafinil for it, and right now it is whooping my butt right now. I'm trying my best to actually keep my eyes open, so you kind of see where that's going, but that's not what this video is about. I apologize for veering off, but so Ocrevus, again, no side effects that I've seen of. After a while, when they do that separate infusion for the first dosage, it counts as one dosage, but two separate infusions. They're going to put you on a single infusion that will allow that's going to be a very slow drip. So you're gonna be there for hours. The people, my MS friends, if you know, sitting in that chair. Hopefully you get in a comfortable place to sit, and hopefully yours is private. I've had private, and right now I'm not receiving private right now in terms of my infusion. So you sit there, you get your infusion. It's you just start to feel better. I don't know. The first one I felt hard. I felt wonderful afterwards. I felt completely wonderful afterwards. But anyway, it was I haven't received anything. The only thing I'll say is, please, especially in this type at this time with all these different sicknesses going on, please take care of yourself. I don't care if anybody has an issue with you wearing a mask. Put it on. Put your mask on. Because if you're taking this, your immune system is affected. Certain ones get affected by the immune system. Put your mask on. Put it on. And it'll protect you. It'll protect you from a lot of stuff. I've gotten sick twice for being hard-headed in that area. It was an upper respiratory infection, but I have no idea, was it a sinus infection or something else? So anyways, you take care of yourself. This does affect your immune system. In particular, B. It affects that. The way it was explained to me was your T cells are the ones who actually go after stuff, and your B cells is a part of your immune system that remembers past ailments so that you can fight them off better. It's sort of like the B cells are sort of like one of those memory books to where they put all the pictures in. Your B cells shows your T cells, hey, look, this is that. So go get it. And by them going go get it, they're a cheerleader. And they cheerlead in our case for the wrong they cheerlead for the wrong team. for the wrong accusation. So so the T cells go after the things they shouldn't be going after. So what basically Ocrevus does is it obliterates your B cells. They're gonna come back. You don't have to worry about that. They will come back. You can still get all your immune shots, your immunal shots. You can still get all those. But like I said, the B cells are basically a cheerleader and a pointer dog for the T cells, and they start attacking you instead of who they're supposed to attack. So again, Ocrevus obliterates your B cells, so T cells are out there going like, I mean, what you want me to attack? That basically that's the way it was explained to me. So by the B cells being gone, the T cells calm down and chill out, and they don't fool with anything. But again, they'll come back. Your B cells will come back. You don't have to worry about that. That's the way you were built. That's the way God built you. So either way, you just y'all be careful. That's the thing you have to worry about. The doctor was asking me because the mask was killing me at some point. Not killing me. Let me rephrase that. The mask was causing an inconvenience, a slight inconvenience. And on top of that, I was irritable today. And that's another video I want to make about is irritability with MS. But you just have to protect yourself. You can easily get sick, so just protect yourself. That's what you have to do. Just protect yourself, and you'll be fine. You'll be fine. And another thing, a quick preview, not preview, but what I'm going to be talking about. I'm actually going to get some more into cognition. The different things that I deal with, and hopefully it'll either verify or you'll know you have company in that issue. That's my goal. It'll verify that that's an issue of MS for you if you don't know. That's something that MS patients deal with. Or I can be a companion of sorts in that struggle that you go through. Knowing that it's not just you that deal with that. And there's going to be sections of the cognition stuff. Other thing is going to be pain, MS and pain. One more other thing is going to be the different tips, like health-wise, that you can utilize. Look at me. I'm not utilizing. Look at these cheeks. So it's some things I'm going to try out, and I'm gonna tell you about. And another thing, the Empower. There is a generic, and it is way cheaper than Empower. So that was the only reason I couldn't take it, and I'm on it now. The doctor prescribed it for me, and I'm on it now. And then I'll also let you in to where I'm actually getting my medication from nowadays. Well, part of my medication nowadays to kind of help cover the cost. I don't have other stuff, so I have to penny pinch when it comes to that type of thing. I have to penny pinch. Oh man. Yeah. Oh yeah, and another thing I want to talk about is the steroids that they give you. What did you hear what happened to me? That was crazy. Well, you all have a lovely day wherever you are, and I'm hoping that, depression also I want to talk about that. I'm hoping you're feeling up. I know you go in and out of depression. I know that. We know that. You go in and out of depression, and sometimes you don't want to do anything, and then you got people all in your ear telling you to push. Either way, we're gonna get into that, basically. So hope you come back for that, and I appreciate all the questions y'all ask, as long as they're, reasonable or well researched. And please don't put anything on. I'll say this: please don't put any misleading or unverified information about MS treatment. Okay? Nothing that's not studied, and any false knowledge or whatever you want. Please don't put that on here. Only established stuff, and don't put that in. And things if you want to put it in the way that you're thinking about doing this and that. I heard about this and I'm thinking about trying that out. That's fine, but don't come on here, please don't put that in the comments. I don't know about all the other MS patients that watch this, or anybody that doesn't, any other MS patients that don't watch this. I don't know about them, but I do not like for anybody to be misled, especially on medical issues, because that can mean somebody's life. So if it's okay, if you want to try that out, that's fine. If you tried it out and you're feeling better, that's fine. But if it's unverified, meaning not just verified by you, but like peer studies that people who deal with this, please don't put it on here. Just say phrase it right. Just say you tried it and you're feeling better, if that's the case. Or if you want to try it, you're thinking about trying, that's fine. But don't come on here saying that that's something that's, it works and all this. Okay, if it worked for you, if you felt like it worked for you, that's fine. But everybody's not you. Just like when I was saying with all the other MS medications I was taking, it didn't work for me, and I guarantee you it worked for somebody else. It helps somebody else that don't deal with what I deal with, okay? But that's verified stuff. Okay, all this is verified, peer reviewed, and all that. So, again, it's something you want to try, that's fine. But if you tried it and you feel like it's working for you, that's good. You can say that. But don't word it as factual. Please don't do that. I don't want anybody to be misled. These people, MS patients deal with enough. You can't see our disease unless it cripples us. So, we deal with a lot of name calling and all kinds of stuff. So just if it worked, okay, just do what I was, do that, and you can put that in. That's fine. You can put that in the comments, but don't do that like it's verified or anything like that. I hope you all are doing well. I hope all the ones in the comments are doing well. I do read the comments. And if I respond, I respond. If I don't, I don't. Most of the comments I'll read. So, I definitely enjoy doing this. I enjoy doing this. It's just that I fell off for a little while, and I'll get into that too. So, but yeah, you got to hear about the steroids, what it did to me. Oh, you just wait.